She wasn't on the surgical team, wasn't even wearing scrubs. But when she picked up the scalpel, they laughed until the bleeding wouldn't stop, and the lead surgeon froze. She leaned in hand steady and stitched a line no one else could. Heartbeat stabilized, and the commander lived. She placed the scalpel down and walked out. If you know skill doesn't need permission, type, she held the line. A high-ranking military commander was rushed into the Basefield Hospital emergency bay after a devastating IED ambush. Multiple shrapnel wounds, severe internal bleeding, and rapidly declining vital signs. The emergency trauma team assembled within seconds of his arrival. The chief surgeon barked urgent orders, while medical personnel scrambled to establish immediate life-saving interventions. She was present in the trauma bay, standing silently in the corner, officially assigned to assist with administrative logistics and supply coordination. No one had bothered asking her name during the crisis. She wasn't wearing standard surgical identification or proper medical scrubs. Prep the chest cavity immediately. The lead surgeon ordered with clinical authority. Apply pressure clamp at the costal margin to control hemorrhaging. Midway through the emergency surgical procedure, the damaged artery rupture suddenly worsened beyond the surgical team's immediate control capabilities. "Where's our vascular surgery lead?" someone yelled desperately. But the specialist hadn't arrived at the facility yet due to transportation delays. The primary surgeon fumbled with instruments as blood pressure readings dropped dangerously fast on monitoring equipment. That's when she stepped forward decisively and picked up the surgical scalpel from the instrument tray. A confused trauma nurse muttered with obvious concern, "What's she doing?" "She's not cleared for surgical procedures." Someone chuckled nervously. "Just watch her pass out when she sees the blood." But she didn't flinch at the sight of trauma or the pressure of the life-threatening emergency. She made one clean, precise incision with surgical confidence and began implementing complex, suturing procedures. Her movements were deliberate and controlled and demonstrated familiarity with trauma surgery that exceeded anything her administrative role would require. The surgical team watched with growing amazement as she executed techniques that appeared beyond their own training levels. Her hand positioning was textbook perfect. Her suturing rhythm was consistent and precise. Her understanding of anatomy was comprehensive and detailed. Someone whose official role involved logistics coordination was demonstrating surgical capabilities that matched or exceeded their specialized medical training. The emergency had revealed a hidden expertise that no one had suspected existed within their administrative staff. Her intervention occurred without seeking permission, without explaining her qualifications, without requesting official authorization to participate in surgical procedures. Just immediate action based on recognition that the patient's life was in immediate danger and available medical personnel lacked the specific skills required for successful intervention. Her confidence suggested extensive experience with similar trauma cases under emergency conditions. Experience that wouldn't be available through civilian medical training or routine military hospital assignments. The precision of her technique indicated specialized training that few medical professionals ever received, advanced capabilities that were typically restricted to elite medical units operating under classified conditions. Her presence in administrative role had concealed surgical expertise that exceeded anything available through normal military medical personnel. Someone whose actual qualifications had been deliberately hidden behind routine assignment that wouldn't attract attention to her true capabilities. The emergency had forced her to reveal skills that she had apparently preferred to keep private, but which she couldn't withhold when someone's life depended on immediate intervention that other medical personnel couldn't provide. Her decision to act had been based on medical necessity rather than official authorization, professional judgment that transcended bureaucratic procedures when faced with life-threatening emergency that required immediate expert intervention. The surgical team was witnessing capabilities that challenged their understanding of who possessed advanced medical training within their facility. Someone they had dismissed as administrative support was demonstrating expertise that surpassed their own professional qualifications. Her intervention was saving a life that would have been lost without her hidden capabilities. proving that assumptions about roles and qualifications could be dangerously wrong during crisis situations that demanded immediate expert response. The lead surgeon snapped with obvious authority, "Get her away from the patient immediately," until he witnessed exactly what she was accomplishing with surgical precision. Her needlework wasn't desperate improvisation or amateur attempt. It was textbook perfect technique, then demonstrably superior to standard procedures. She implemented an interloop suturing method in a complex configuration that no one in the trauma room had ever seen before. A moment later, the cardiac monitoring equipment showed immediate stabilization of previously erratic vital signs. Pulse holding steady, blood pressure rising to acceptable parameters. The anesthesiologist reported with obvious amazement. The chief surgeon leaned closer to examine her work with professional curiosity. "What specific technique is that?" "I don't recognize the suturing pattern." She didn't provide verbal explanation, just nodded toward the pressure clamp and said with quiet authority, "Maintain pressure here. He'll achieve full stabilization." Then walked purposefully out of the trauma bay, without seeking recognition or acknowledgement for her life-saving intervention. In the hospital quarter, a persistent trauma nurse caught up with her retreating figure. "Who exactly are you? What's your medical background?" She paused momentarily, considering whether to answer the question. "Someone who didn't want him to die needlessly," she replied simply. Hospital security personnel immediately reviewed her facility access badge, completely blank information. Temporary authorization, no department designation listed. But when technical staff checked internal security footage and analyzed the suturing sequence in slow-motion replay, one critical detail appeared in a pause frame. Cox and Loop 7 configuration, a highly specialized suturing technique only ever published in classified military medical journals. Documentation that wasn't available through civilian medical education or standard military medical training programs. Advanced procedures developed specifically for combat trauma situations where conventional surgical methods were insufficient. Her implementation of classified medical techniques revealed training that exceeded anything available through normal medical certification programs. Experience that could only be obtained through participation in specialized military medical units operating under classified conditions. The Cox and Loop 7 was legendary among elite military medical personnel, a procedure that could save lives in situations where standard techniques failed. But it required extensive, specialized training that few medical professionals ever received. Training that was restricted to personnel who operated in conditions where conventional medical support wasn't available. Her flawless execution of the technique indicated not just theoretical knowledge, but extensive practical experience under combat conditions. Someone who had performed similar procedures multiple times under pressure situations where failure meant death. The precision of her intervention suggested muscle memory developed through repeated application of advanced techniques, experience that could only be gained through assignments that officially didn't exist in medical personnel records. Her ability to assess the situation and implement appropriate advanced procedures within seconds indicated training that emphasized rapid decision-making under extreme pressure. Capabilities that were developed specifically for medical personnel who operated independently without supervision or backup support. Her intervention had demonstrated not just surgical skill, but tactical medical thinking that anticipated complications before they occurred. Understanding of trauma physiology that allowed her to implement preventive measures rather than reactive treatments. The successful stabilization of the patient proved that her assessment and intervention had been exactly what the situation required. Expertise that had saved a life through methods that conventional trauma team couldn't provide. Her decision to walk away without explanation suggested someone who understood that her intervention couldn't be officially acknowledged, that her presence and capabilities needed to remain unofficial for reasons that transcended the immediate medical emergency. Someone whose background required anonymity, even when providing life-saving medical intervention. The trauma team had witnessed expertise that officially didn't exist, but had just prevented the death of a high-ranking military commander. The hospital administrative team immediately pulled comprehensive background verification, biometric data, access badge information, facial recognition analysis through security databases. All searches return minimal results. A single heavily redacted archive file, surgical advisor, Omega trial protocol, redacted security clearance. She had once served on classified trauma units during covert military operations, where patients possessed no official identities and medical personnel operated under extreme time constraints. Her specialized technique had been developed specifically to repair complex vascular tissue damage in under 15 seconds without access to standard surgical clamp equipment. The reason her methods weren't widely known, they were never intended for public medical education or civilian application. She wasn't just trained in advanced procedures. She had personally authored the emergency fallback medical protocols used in classified operations. But after one critical operation failed due to political interference rather than medical factors, she voluntarily walked away from official service. No formal resignation submitted, no explanation provided to superiors, just complete disappearance from all official medical personnel rosters until today, when she couldn't allow someone to die because of institutional pride or bureaucratic limitations. Her intervention had been driven by medical ethics that transcended official authorization or career considerations. One trauma surgeon whispered to his colleague, "We just received life-saving assistance from someone who officially shouldn't exist." The classified nature of her background explained her reluctance to provide identification or seek recognition for her capabilities. Someone with her training history would understand that exceptional medical demonstrations could trigger investigations that might compromise ongoing security operations. Her preference for anonymity protected not just her own privacy, but the classified medical programs that had developed her extraordinary skills. The Omega trial protocol had been designed to develop medical personnel capable of saving lives under conditions that exceeded normal trauma surgery parameters. Situations where conventional medical equipment wasn't available and time constraints eliminated standard surgical procedures. Operations that required medical personnel who could function independently without supervision or backup support from other medical professionals. Her training had prepared her for medical emergencies that officially never occurred, but which required capabilities that conventional medical education couldn't provide. The successful intervention demonstrated that her skills had been maintained and enhanced during her years away from official service, that she had continued developing capabilities that could save lives even without institutional support or recognition. Her civilian appearance and administrative assignment provided perfect operational security for someone whose actual qualifications far exceeded what anyone would expect. Cover that allowed her to maintain her skills while avoiding attention that might force her back into official classified medical service. The Trauma Bay intervention had been both demonstration and warning evidence that her capabilities remained available if genuinely needed for life-saving purposes, but wouldn't be used for operations that conflicted with her personal medical ethics or professional standards. Her technique had communicated her position more effectively than any verbal statement could have achieved. Proof that retirement from official service didn't mean abandonment of medical responsibilities that transcended institutional boundaries. The commander's successful recovery would serve as testament to capabilities that remained available outside official medical channels. Evidence that some medical expertise operated according to humanitarian principles rather than bureaucratic authorization. Her intervention had saved a life while maintaining the anonymity that protected both her identity and the classified medical programs that had trained her. The perfect balance between providing essential medical care and preserving operational security that kept her capabilities available for future emergencies. The trauma team had been privileged to witness medical expertise that few people ever encountered, but which remained dedicated to preserving life regardless of official recognition. The military commander achieved rapid recovery faster than medical projections had predicted. When conscious, he immediately asked who had performed the life-saving surgical intervention. The trauma team hesitated uncomfortably. "We don't know her actual name or official designation, but a handwritten note was discovered on the medical clipboard beside his hospital bed. The line held. No signature or identification, just a distinctive Mark II intersecting surgical threads stitched perfectly through a paper corner with precision that demonstrated exceptional fine motor control. New comprehensive training modules were uploaded across every military medical facility throughout the network. One advanced suturing sequence, completely unattributed to any source, but designated as mandatory training for all trauma surgical personnel. Medical instructors now pause during advanced procedure lessons and emphasize, if you ever observe someone implementing this technique, step aside and allow them complete authority. Her personnel file remained permanently sealed at classification levels that exceeded normal medical administrative access. But in every trauma treatment room throughout the military medical system, now hangs a professionally printed phrase taped to the wall. Skill doesn't require rank, only clarity of purpose. The phrase became unofficial motto for military medical personnel, who understood that life-saving capabilities sometimes appeared without official credentials or institutional authorization. Recognition that medical emergencies required flexibility in accepting assistance from sources that couldn't be verified through standard bureaucratic procedures. Her intervention influenced medical training protocols throughout the military healthcare system. Emphasis shifted toward recognizing expertise regardless of its source, rather than restricting medical intervention to officially credentialed personnel. Understanding that some medical knowledge existed outside institutional boundaries, but remained committed to preserving life when circumstances demanded immediate expert intervention. The Cox and Loop 7 technique became standard curriculum in advanced military medical training programs. But students learned the procedure without understanding its origin or the person who had developed it. Her contribution to military medical capabilities remained as anonymous as her identity. Training materials referenced her innovations without providing personal details or background information. Medical professionals learned life-saving techniques that had been pioneered by someone whose existence couldn't be officially acknowledged. The ultimate example of medical service that prioritized patient outcomes over personal recognition or career advancement. Years later, military medical historians would attempt to document significant developments in trauma surgery techniques. They would encounter systematic gaps in available records about the origin of procedures that had saved countless lives. Technologies and methods that clearly existed, but had no traceable development history or identifiable creator. Her influence on military medical practice was comprehensive, but completely invisible to academic research or public recognition. But medical professionals understood that certain improvements in trauma surgery had prevented deaths that would have occurred without capabilities that transcended normal training. That some medical innovations had been developed by individuals whose expertise remained classified for reasons that exceeded medical considerations. Her legacy lived in the lives that continued because someone had possessed capabilities that officially didn't exist but remained available when desperately needed. Evidence that the most important medical work sometimes happened in complete anonymity. That true medical expertise served humanitarian purposes rather than seeking institutional validation or professional advancement. The commander survival proved that some capabilities existed beyond official medical channels, but remained dedicated to preserving life regardless of bureaucratic limitations. Her intervention had demonstrated that medical skill recognized no boundaries when faced with someone whose life hung in the balance. If you believe there are hands that save more than they speak, subscribe to The Ordinary Heroes.